My name's Dr. Caroline Reid O'Connor and I'm a specialist registrar. I'm dual training in medical psychotherapy and general adult psychiatry. I'm going to talk today about two different types of talking therapies or psychotherapies that are used in the NHS today to treat patients with mental health problems. Those two talking therapies are CBT, or cognitive behavioural therapy, and psychodynamic psychotherapy. Like all psychotherapies, they have things in common and they have differences. Let's start with where they come from. The psychodynamic psychotherapy was born off the back of the work done by the psychoanalysts of the late 19th century and early 20th century, such as Sigmund Freud and Carl Jung. Whereas CBT was developed slightly later in the mid-20th century off the back of the work of the behavioural psychologists and cognitivists, looking at how we think and how we feel and how we behave, and how those three things interact in the here and now. Another way in which these two therapies differ is in their setting. In psychodynamic psychotherapy, it's quite important that the setting remains the same. The idea being that if you're in the same room every week at the same time with the same therapist, that the only thing that's different is what's happening between the therapist and the patient in the room at that time. Whereas with CBT, there's less of a focus on the setting, and we do it in a wider variety of settings, from a clinic room to somebody's home to out in the community. The other difference between the two is the length of time they take and how often you see a patient. So with psychodynamic psychotherapy, you can see a patient up to 3 times a week for up to 18 months. Whereas in CBT, it's a much more shorter, more focused therapy, seeing a patient once a week for between 12 and 20 sessions. So in summary, CBT, cognitive behavioural therapy, and psychodynamic psychotherapy are two psychotherapies that we use in the NHS today to help treat people with a variety of mental health problems. They're both very effective and they're both great fun to do.